Hi, everybody. Welcome to the webinar. We're going to wait a couple of minutes for more people to join, and then we'll get started. Welcome, everybody, to the webinar. We're going to get started in a couple of minutes. Okay, we'll give it one more minute, and then we'll get started. Okay, everybody, welcome to the webinar for ASAP2. The title of our webinar today is Communications, and it's going to be presented by Ellen Langhans. You was going to do that, Langhans, from the Office of HIV/AIDS. My name is Catherine Brokenshire Scott, and I'm the project director for ASAP. Welcome, everybody. Before we get started, please let us know where you're from. Please use the chat to introduce yourself to the whole group. Please put your name and what organization you're with and what country you're from. We'd love to know who's in the room. Please use the Q&A box. You'll see it at the bottom of your screen. Please use your Q&A box to ask questions. And then at the end of the presentation, we will answer those questions. The presentations for today's webinar will be saved on the ASAP website as usual, and you will see, you can go to www.intrahealth.org/asap.resources for the full set of webinars. We have done over 100 webinars, and they're all on our website. A little bit about ASAP. So ASAP stands for Accelerating Support to Advanced Local Partners. We started in April 2019, and we are ending July 30th, 2024. So we don't have very long to go. The purpose of the project is to rapidly prepare local partners to have the capabilities and resources to serve as prime partners for USAID PEPFAR programming and in compliance with USAID PEPFAR procedures and program implementation. So we help local partners understand all of the USAID compliance requirements for managing funds from USAID, as well as all of the PEPFAR implementation requirements with all of the reporting criteria. We currently have worked in 18 countries, and you can see the list here. We had some in ASAP 1, and then we've added some under ASAP 2. So currently 18 countries. As a result, we've worked with over 126 local organizations, 18 countries. 113 of these local organizations have been NGOs and 13 have been local government entities. So again, I just want to repeat that this presentation and all other presentations are on our website. We have over 100 webinars and a lot of other resources, so please take the time to visit our website. So now I just want to say thank you and enjoy the webinar, and I'll turn it over to Ellen Langhans to do the presentation, and to Jackie Dreesen, who is our capacity advisor in Cote d'Ivoire, who will be asking questions to Ellen. So please put your questions in the Q&A, and she'll sum them up at the end of the presentation. Over to you, Ellen.
Thank you so much. I'm really thrilled to be here. Just some housekeeping. It looks like the chat may be disabled. Someone put up something in the Q&A saying the chat is disabled. So if we can figure that out so folks can type in where they're from and who they work with, that would be amazing. And if not, I guess you can always use the Q&A box and we'll just figure it out. My name is Ellen Langhans. Let me share my screen so you can see a picture of me on my screen. All right, can I get a thumbs up if everyone can see my screen? Yes, okay, great. So here's my cover slide, and this is me. This is actually taken at the White House. I went bowling at the White House, and it was very cool. So this is picture of me. My name is Ellen Langhans. I have worked in USAID's Global Health Office of HIV/AIDS for about 4 years. I started in April of 2020. That was also when I started in global health. So put 2 and 2 together. It was a very interesting time. But I am thrilled to be here. I have been working in communications specifically around health since about 2011, and it's really such a gratifying job, and I'm thrilled to be here to talk about it with you, and I look forward to some discussion at the end of the conversation and hopefully to make some contacts and be able to work with you. I like to call the big international organizations some of the Beltway bandits, and we have some good relationships with them, but I find that I really want to connect with the folks in country, on the ground, our local partners, all of you, because those are where the real stories and real great information is coming from. So I'm just so thrilled to be here. So here's a little bit about what we'll cover today, but essentially we're just going to talk about telling your story. And by your story, I mean the story of your work, your program, the people who benefit from PEPFAR and what we do. So we'll do a little bit of background on how to do it, developing one, of course, photography, because we all know a lot of people like to look at pictures and reading can take a while. So let's make it visual. And then how to work with us. And then there's just a list of resources at the end. And again, this will be posted on ASAP's website, so you will have access to this. But why is it important to tell your story? There's a lot of reasons. Obviously, we educate people about what we're doing. We want to empower your teams and your partners to be good stewards of your messaging. But I think the real value is engagement. It's really engaging with people. I know PEPFAR is very focused on data and reporting, and I know you know that, but people forget facts, right? But they remember stories. They remember things that make them feel something. It's a way to connect with people. It's a way to learn about other people's stories. It's a way to learn why work is important and why we do what we do and why why we should care. I think engaging with people and creating that connection is 100% the reason why I do what I do. So really, why is this important and why should they continue? We have lots of storytelling platforms. I will talk a little bit about each one. The Medium blog, no, it's not USA.gov. USAID's Medium blog is it's a storytelling platform. It's not hosted on the .gov website. It's its own website, but it's primarily text-based, but there are pictures. We usually like to include at least 2 pictures. And the Medium platform is really for those human-centered stories. So less about maybe some of the technical work, although it's important and there's a time and place to talk about technical work. But it's really the place where we talk about who are the people that we're helping and why is it important. Exposure is similar, very human-based, but very photography-based and really good high-quality photos. I'll get into photography a little bit later in the presentation, but again, it's so critical to be able to tell our story visually, especially in this world where there's so much information and people are pressed for time and we're competing with so many different things. But if we have a really compelling story, people will stop and look. We have LinkedIn, which is, of course, a professional networking and job platform. And USAID has its own LinkedIn page, and I believe there's over 2 million followers. Now, we can use LinkedIn a little bit more for the technical information because there are, if it's your audience is other professionals. So it's a really good platform to talk a little bit more about the technical pieces of the work, maybe for lessons learned, for best practice sharing. And again, a few photos are always helpful. And then we have our Office of HIV/AIDS blog that is on USAID.gov. We have our own website on USAID.gov. It's in the global health section of the website, and Office of HIV/AIDS has its own site. And there's a blog. Again, this can be a little bit more technical in nature because it is hosted on our site and it is for folks who want to learn more about our work. You'll see that all of these are rather short, right? The longest one looks like it's on Medium, 600 to 800 words. So part of storytelling is learning how to do it succinctly. And I know when we write reports and you're reporting on indicators and, if you're doing anything to report up the chain, you want to do as much detail as possible. For storytelling, you want to get right to it, right? Why is this important? Hook them with the right sentence at the beginning of the paragraph and you got them. So here's just an overview again of what these platforms are. And then you can see the reach. We've got quite a few followers on Medium and Exposure, but if you look down, social media, especially LinkedIn, 2 million followers. So there's really so much opportunity to be able to work together to talk about your work and why it's important and just the reach that we have. It's pretty incredible. So here's just a slide of some of the platforms and what they look like from left to right. This is on Medium. This was actually a story I wrote when I was in Malawi last year. And this picture is of Violet. Violet was born with HIV and she was on medication and decided she didn't want to take her medication anymore because she didn't know why she was taking it. So she didn't learn why until she was about 11. And so this story is about Violet, and it's also about a woman named Teresa, who is an advocate in her community for testing and staying on treatment. And the point of the story is to talk about why treatment is so critical, right? Why staying on treatment is critical, why achieving viral suppression is critical. But it's not talking about treatment and viral suppression. It's talking about the people and providing that connection. In the middle, we have Selly. Selly is a dreams ambassador, and this is a photo story of Selly and talks about why she does what she does. Why is she a dreams ambassador? What's in it for her? What does she get out of it? She's a really great community leader. She loves connecting with the girls in her community. She wants to empower them. She wants to educate them. And this is a story that's more based in photos that sort of goes through a day in her life and talks about why she does what she does. It's a really powerful, beautiful story. And then the third one is on our Office of HIV/AIDS blog, and this is talking about empowering nurses as leaders in Malawi, talking about why nurses are so critical in the health workforce. Obviously, well, maybe not, you didn't know, but last weekend, May 12th, was International Nurses Day. And PEPFAR has a new nursing leadership initiative. And so we timed this so that we talk about why nurses are important. And we socialized it on International Nurses Day. We'll talk a little bit more about a hook and timing later. But this is a really great story. My colleague Cassie wrote this. And yeah, so that you can see that the human-centered stories can take on different approaches. It can be about people who benefit from the program. It can be about the people who implement the program, but each story is really powerful in its own right. So talking about social media, like I said, when you write a story, obviously you need to share it and you need to amplify it on social. So here's just some best practices and tips of how to do that. If you do have a social media account for your work, always tag us so that we know and we can see it and we can help amplify it. And if possible, we always try and say through PEPFAR and USAID. Obviously, you know, branding follows funding, and PEPFAR is the funding, and then USAID is the funding. Another thing we say, we try and not say clients or patients, it's people living with HIV. Again, the importance of telling the story is really humanizing it and talking about why and who, and really giving that element of why people should care. And then importantly, and this can be challenging, using plain language. Plain language is the simplest way to say something. And that can be quite hard because we work in a very technical field. And 4 years later, I'm still, brushing up on my plain language skills. But, things using the word use instead of utilize, avoiding jargon and acronyms. PEPFAR is littered with acronyms. When I first started, I downloaded the PEPFAR app because there is an app for all the acronyms. So we like to, as much as possible, avoid those because it just makes it so clunky to read when you're reading something and then you're coming up on all these acronyms. You're like, what does this even mean? It's like reading a different language. So these are just some social media tips, and this is just tips in general for writing as well. A critical piece, actually the first piece, whenever you start writing a story, who's your audience? Who are you writing for? Are you writing for your mission in your country? Are you writing for the leadership there? Are you writing for us in headquarters and the leadership here? Are you writing for things in your country, the Ministry of Health or civil society organizations, other public health professionals? We always start whenever we write something with who are we talking to? What do we want them to know, right? But also, why do they care? So knowing who your audience is really critical. It helps us decide where the best place is to publish it. It helps us think about how we want to publish and amplify it. So always, I think the number one step is who's your audience? Who are you writing for? And it could be that you're not writing for public. It could be that you're writing for other partners to learn from your successes. Or it could be that you really want the leadership of the mission in your country to know all of the great work you did. But knowing who your audience is so critical. So always start there. Okay. How do you tell your story? I talked a little bit about some of the components, using plain language, knowing your audience, thinking about different platforms. Here they are in a slide. Audience, always first. Who are you writing for? And then what's your message? What are you trying to say? What's the USAID connection so that, we can collaborate together and we know exactly what, the USAID connection is. For us, for OHA and my communications team, our North Star is always talking about USAID's role as a key implementer in PEPFAR, what our strengths are, where we lead, what our successes are. And so any of the stories that we can tell together should always have that connection of how USAID and your organization work together to achieve something. Again, human-centered if possible, but again, it doesn't have to be. It depends on who your audience is and what you want them to know. The hook is really critical because there's so much information out there and we're always competing for people's attention. Having a hook is really key because you want people to understand, why are you telling me this now? So for example, that blog about the nurses in Malawi, we did that for International Nurses Day. It sort of frames it and gives it context. I think, the information is always important. We know that, but people need to know why they should care and why, like now. So it's timing, it's relevancy, it's that hook. And again, lots of photos, and we'll get into photos in a little bit. So here's a really critical slide. Here's a lot of the priorities that we as USAID Office of HIV/AIDS are really focused on talking about and telling stories. Number one is sustaining the HIV response. I know there's a lot of discussion and webinars and emails and information about planning for sustainability. UNAIDS is coming out with the UNAIDS sustainability roadmaps. What does that mean? So part of my team's job this year is to figure out what it means, why it matters, and what USAID is doing. Because right now we're all working towards that ultimate goal of ending HIV as a public health threat by 2030. And to do that, we need to sustain the work we've done already and then accelerate the progress. And so this is a huge piece of what we'll be focused on this year. And this is actually very interesting because there's so many pieces of it. Sustaining the response is very much technical work. I actually will be going to Namibia in a couple weeks to learn about the work that the USAID mission and its partners are doing there in sustainability. It includes things like health financing and government-to-government agreements and working with the Ministry of Health. Those aren't human aspect stories, but they're really critical to tell. And those kinds of stories are really important for us to be able to know about and to share so that others can learn from each other and we can all sort of work towards that collective goal together. Another thing is localization. Here I am talking to our local partners, so clearly this is a priority. USAID has a big goal of having 50% of its work implemented by local partners. The Office of HIV/AIDS really leads the agency in working with our local partners. And again, so thrilled that we get this opportunity to speak together and I can know who some of you are, you can put a face to a name, and we can, work together to talk about this stuff. And then I won't go through all of the priorities. You can read the slide, but these are just, these are some of the things we'll be really laser focused on this year and looking for those stories and examples and ways to bring them to life. How do you develop a strong story? So these are just some examples of the types of stories. I know we've talked about sort of the human-centered versus the technical aspect, but here's a little bit more. So I think there can be, I think they're going to put some links in the chat, but here's an example of 3 types of successes. So the program participant highlight, right? And we talked about this one. That's the blog about Violet and Teresa, really highlighting the human aspects of PEPFAR and partners and how we work together to impact people's lives. But then there's other stuff. There's policy shifts. We know that lots of countries need to change some policies in order to achieve the 2030 goal. I know during COVID, a lot of policies shifted to allow for multi-month dispensing of medication. So there's lots of things that we can talk about in terms of policy shifts and landscape shifts, right? Building partnerships. making those connections, the government to government agreements. There's different ways to sort of parse out what the story is. And then I think if in the chat, the links are in there, you can go explore and see sort of what these look like. Here's a handy checklist. You can print this out. These are some components of a strong story. I love a good checklist. Mostly I like a to-do list and then crossing it off. But it's nice to have a reminder of, these are the things that we could do. Here's what needs to happen. So obviously photos, information on if it's a person, who they are, where they're from, what's the problem. Definitely strong quotes always help a story. There's a way on these platforms where we call them like call out quotes, and really strong statements just make such an impact. And then we can also use them in like a social media post to amplify the story. So this is just a handy slide to check off for things that make a strong story. Here's some do's. Show, don't tell, obviously, with photos. Right for secondary school audience, this speaks to that plain language aspect that I talked about. Use the word use instead of utilize. Use photos. Definitely include the role of USAID. Focus on outcomes rather than input. Be clear, and don't forget to highlight the ties to our priorities. So again, here's the impact. There's the input and the output, right? What happened? What happened? What did we do? What was the outcome? How many people do we reach? But really what we care about is the outcome of the overall impact, right? If we reached 500 people with treatment services, did we achieve some viral suppression rates there? If we delivered HIV testing commodities, did we help increase the first 95 for that country? Really focus on what the outcome is rather than the input or the output. Here's some don'ts. Acronyms, don't use those. Avoid the jargon if you can. You don't need to include quotes directly about USAID. We like to talk about ourselves, but subtle. And then pictures of staff meetings or slides, not super engaging. So here's a really cool way to think about repurposing your work, because obviously when you write one thing, it'd be great to use it again. I love repurposing things. We repurpose talking points for different things. If you have an interview, so for example, you interview someone who's benefited from PEPFAR programming. You can write a success story about it. You can include it as a text box in a report. It can be a press release. You can take some photos and use the photos on social media. Again, with the quotes, really strong quotes are really powerful on social media, combined with a picture, wonderful. You can add it to a newsletter. There's so many ways to use stories and repurpose them for different purposes. I think the reporting thing is key, because I'm sure that partners have to report on a lot of things. And what a way to bring your work to life, to have little snippets of stories in your report. Photography. What to shoot. We love people pictures. Love people pictures, health workers, people in action. Horizontal is preferred just because of the formatting we have for blogs, but we love images. And obviously during COVID, we weren't able to get a lot. So I would love to be able to work with you all and collect photos. There's so much you can do with an iPhone these days. You don't even need a professional camera. The iPhone can take amazing photos. Here's some ones that are less interesting. Meetings, places with no people, equipment, slides. But a key piece, especially because we love the people pictures, is consent. Always asking permission. And then really being explicit about the use of the photo. Because you could tell someone, I'm taking a photo for an HIV campaign, and they could maybe understand it, but you really want to make sure people know that their face might be used, where it could be used. It could be used on a public website. It could be used on a poster in their town. Always, always, always have consent and have a signed form for the consent. And if you don't, right, if there's something that you want the photograph for a story, it's possible to take a very compelling picture and not show someone's face or hide their face with something or focus on their hands or, standing with their back to you. There's lots of ways to do it, but most important, critical, critical, critical is having consent. Get on the same level. Connect with them. See if you can get a response. Use the rule of thirds. This is a great way to do this. Sometimes it's boring sometimes to look at a picture head on and it's just right smack in the center of the picture. So a little bit off center or a little bit down below. The rule of thirds is really quite powerful. People in action is always interesting. And just keep shooting. I take a lot of pictures, but the more pictures you take, the better chances you have of getting something really great. And you can always delete the other ones, but just shoot for that one great shot. So here's an example of some photos from our partners. We've had some photo calls and contests over the years that I've been with Office of HIV/AIDS. And again, we are always looking for more photos and we would love to have those submissions from you. These are some wonderful examples. It's always, of course, the one on the bottom in the middle having some USAID branding, but it's not even, that isn't critical. What is critical is that the image is compelling and it shows our work. We want to collaborate with you. I think I've said this, but I'm going to say it again. We are so excited to have this opportunity. I say we, my colleagues Jenna and Cassie are also on the call. We are just so thrilled to be able to have this opportunity to know who some of our local partners are. Because there are so many of them, it can be hard. My team, there's only 3 of us, but we are rock stars and we want to work with you. So how do we do this? Always make sure the AOR COR approves. Got to make sure. And email us. Our email is right here. You can email us a pitch. We generally like to work with you rather than receive fleshed out stories already written, because we love that collaboration and we love to be able to work with you. Again, look for the hooks. Why now? How should we tell the story? Definitely some notice is good. It's the government, so it takes some time to clear things. And then we can always work together for Google Drive folders for uploading photos and figure out all the details. But really importantly, the first 2, check with your AOR and email us and let us know, and let's work together. Again, just some writing tips to have on hand. Feel free to print it out. Just always good reminders. I actually might print this out and put it on my wall. And here's some resources. We also have them translated in French, Portuguese, and Swahili, and they will be posted on a website soon. They haven't been posted yet, but feel free to email the OHA Communications team email for any sorts of resources, to work with us, just to say hi. So thrilled to be able to be here, and I really hope that there's questions and conversation because I'm happy to answer them. Thank you very much. Thank you. If anyone has questions, please ask or just email us. Whatever works. We are happy to answer questions, but so thrilled to be able to do this. Yes, please use the Q&A if you have questions. And if you don't, I really do hope that you email us. My colleague Cassie just put our email in the chat. What can we do when we're facing lack of resources? Great question. I wish I had the answer to that. But if it's lack of resources for telling your story, use us. We're here. We're here to support you. We're here to help. I can't speak to funding, but if there's lack of resources in terms of, human resources to be able to do it, we're here to provide that support. No apologies. How do you typically handle consent for, oh, yes, that's a great question. If parents aren't around and there isn't a legal caregiver, it's better safe than sorry. And not use the photo, be able to take it again. Like there's ways to take photos without using faces. You can take it with their backs to you. You can have pictures of their hands doing something. I would say get creative because the consent is so critical. Oh, continue working with USAID when policies. That's a great question. I can answer the communications questions. Specific advice you can give us when we want to talk about MSN. Okay. So yes, there's definitely ways to talk about men who have sex with men, other key populations. When we do it, we really try and focus on the health equity message, really, because reaching the populations that need to be reached the most is how we're going to get to that goal. So focusing on the health equity, and, obviously, like to protect identities, we would change names. Again, not using the faces on pictures, showing other ways of, capturing the images. So just being sensitive, but focusing on the health equity and why we are focused on key populations. Do not include direct quotes about you. That's more just, no one wants to read about the donor. There certainly can be talking about working with it, but in terms of like quotes, like powerful quotes, the powerful quotes are about people, not the big donors. That was what I meant by that. What happens when a person consents for photography and later say, that's tricky. If they sign consent, right? It's already been signed. But if you haven't used the pictures yet, then respect their wishes and don't use them. What do you do when you find a compelling moment to capture, but not an opportunity to get? Again, try not to get the faces, get the actions. There's actually, it's quite creative to get something that's compelling without showing faces. And it's tricky, but that goes back to the take lots of pictures. Take lots of pictures and choose the one that can be compelling, that doesn't have, any identifying features. I think that is probably a good way to do it. Getting down to the subject's level, as opposed to standing up and looking down at something. It's like getting on their level, like creating that connection, right? As opposed to, although looking up can kind of be cool for perspective and creativity, but really just getting to the level so that when you're looking at it, you feel that connection with the person. Okay. I hope I answered those okay. Joint social media trends, are there limits? Oh, as a comms person, yes, thank you. Yes, and you will get the slides will be posted on ASAP's websites. Social media trends, that's tricky. I think honestly for us, it's more about the timeliness and the relevancy as opposed to trends. Trends come and go. Always, for X and things like Instagram, using the right hashtag so people can search it. But I would say focus less on the trends and more on the content. What is your view on editing photos? That's a great question. I am not a graphic designer, so I don't personally edit photos, but are you talking about like Photoshop or editing how? Yeah, oh, I'm in the Q&A now too. Yes, at public meetings, yes, do it at registration always. What are the key elements to make the story more attractive? What do you mean by that? I think I can try and answer that. Obviously, making it timely, relevant, focusing on the human aspect, and the impact, focusing on what the impact is. I think that's always something that makes a story more attractive is focusing on why it made a difference and how. Thank you, Cassie. My colleague answered the question about photo editing. We recognize the importance of how can we respectfully capture the essence of their story while ensuring? Good question. You prefer to read? Yep. Again, it's getting creative about telling the story. There's ways to capture people without capturing their face, focusing on what their hands are doing, getting something from behind. The use of shadows and lighting is always pretty critical when you're trying to, obscure. I would say not to blur any faces. But just being creative about how you capture them for sure. Because yes, it is such a sensitive subject, and some people may not want to be photographed to be recognized, but there are ways to do that for sure. Compared to video and audio, yeah. Um, my answer for that is that because people have such limited resources, it's just a little bit of a lighter lift to be able to do a text story with photos. Obviously, audio and video are very compelling, video especially. And if you have the resources, sharing short videos on social or adding a short video as part of a story is quite compelling. But it is a heavy lift, and there's a lot of stuff that goes into that. So I think we err on the side of text because it is just more accessible for folks and easier lift, especially with limited resources, limited time. But again, that's why photos can be so compelling and critical, because with text, you always want to be able to show the story as well. Because again, like we know that visuals are compelling and people get engaged. You can be engaged by looking at something. And so getting those visuals is critical. And always get consent. Yes. Consent, consent, consent. Thank you, Cassie. Do you experience creative block? Yes. How do you? Well, I'm lucky because my whole job is to work in communication. So yes, it's, in a fast-paced workspace, it gets tricky. Um, that's a great question. Creative block. I mean, honestly, like because the content that we work with is so compelling, I don't necessarily get creative block. But I think, oh, Cassie, do you have recommendations for how to get over creative block? Put it in the chat if you do. Um, If your story is about is through your organization, yes, get it, but also um collaborate with us instead of sending us written stories. We love to work with you. But yes, your AOR or COR should approve, and yeah, it should be approved before we start working together. I didn't, oh, under what condition? We don't usually blur faces, to be honest. I don't know that USAID has a policy on it, but just for like visual attractiveness, I think we would focus more on trying to capture the image of the person without getting their face as opposed to blurring it. Yeah. Do we still need, oh yeah, that's always tricky. Cassie put some ideas in the Q&A for getting over a creative block. Group photos are a little bit trickier. And like honestly too, I think group photos or pictures of lots of people in public spaces aren't necessarily always the most compelling. Um, that's trickier. Public awareness campaigns. Yeah. I would say try your best, but also like large groups of people without sort of like, do you know what I'm saying? Without like a focus of the picture, it might not be as compelling of a picture. What else? Anything? Lots of questions. I'm really glad you guys are asking. And I hope I'm doing an okay job answering. But always, always feel free to email us as well. oha-communications-team@usa.gov. We really would be so thrilled to even just say hi and know who you are. It would be great. What else? Anything? I'm so thrilled that you guys are asking questions and that I really hope you found the presentation valuable. I hope you at least use one slide out of all of them. Some people will give you, but later on for publishing and crowdfunding. That's a hard situation. I mean, if you get consent and someone changes their mind later, um, if you're worried about that, I think the best thing to do is, again, find a way to capture something without using faces or identifiable features. I honestly think better safe than sorry. So if you are concerned, I think there's ways to capture things without using their face. And so to really figure out what that looks like and get those. Oh, the best iPhone for photos. I don't know that because I use an Android. Honestly, I think any iPhone takes amazing photos. My Android takes good photos too. But honestly, and I think there's settings that you can adjust to get, larger images, which will also provide more detail and crispness of the picture. So yeah, probably any iPhone. Use photos from one assignment with consent. I don't know what that means. Like from one project to a different, I would say just, I always err on the side of being as truthful as possible, and as upfront as possible. So I wouldn't represent one project with another one. If it's something very generic, like a picture of a pill bottle or something, then I think maybe that's better. But for people, I would say try not to do that. You're welcome. Thank you for the question. What else? Anything else? I think we're I think we're good. Oh, are there more? Thinking of good length of a story. Yep, that's a great question. I covered that in the slides. Generally, for a text story, we aim for 600 to 800 words, which sounds like a lot, but it's actually quite succinct. So it's really important to get to the, the message and the point of the story to do it succinctly. For a photo story, like if we did it on our exposure platform, it's fewer words, anywhere from 250 to 400, because we really rely on the pictures to tell the story. But if you are writing a text blog, aim for 600 to 800 words. Can I adapt paid internet resources to tell my stories? I don't know what that means. What do you mean by paid internet resources? If you can explain that question, I can try and answer it. I don't know what paid internet resources means to adapt. Kelsey, can you explain what you're talking about? And I can try like pictures. Oh, like stock photos. AI generated images we cannot use. So I would stay away from those. We don't use AI generated images. If you're talking about stock photos, scenery and videos, I mean, you could. I mean, if you're paying for them, then you're paying for the license, and you can use those. But generally speaking, we really like to capture what it is we're writing about specifically. So if you can, it would be better to get things that are actually like where you are, because I think that that is the most compelling. Stock photos tend to be a little bit more generic, where like you can get something very specific to help tell the story you're trying to tell. And again, no AI generated images. What is the ideal time frame? Oh yeah. I mean, the ideal time frame is when you're publishing it, right? We can reuse photos, and we certainly do in our social media or our newsletters. But I think the ideal timing is when you're publishing it. So if it's a story that you're publishing on a blog, use it then. But I think again, just like you can repurpose content, I think you can repurpose images as well, because it's obviously not feasible to get fresh pictures, new pictures all the time. So I think it's okay to reuse them and repurpose them. But if you're writing about something specifically, it's best to use the pictures taken for that specific reason. But if it's something that's really compelling, use it in a report, use it on social. Like if there's something compelling, you want to use it again. What else? Anyone else? I'm loving these questions. Although it's kind of weird because I feel like I'm just talking to myself because I only see myself on screen. Anyone else have questions, comments? I really hope you email us so we can say hi and know about your work. Oh, good. Mm, more tips to grow engagements on our post organically. Jenna or Cassie, do you want to pipe in with that one? Jenna is our social media guru, and Cassie is our communications advisor. I'm going to ask them to answer that because they are better equipped to answer that. So Jenna or Cassie, if you can answer or try and answer or give Kelsey some tips on growing engagements organically. That's a tricky one. Social media, and it's constantly changing. The landscape is constantly changing. So that can be trickier for sure. I mean, obviously, when you have engaging content, you hope it performs well. Um, but I'm going to ask them to weigh in there. Tagging other accounts, include, yeah, great. Commonly used hashtags. Thanks, Trevor, for that. Thank you very much. I'm glad this has been useful. I hope it's been useful. And Kelsey, if you want to talk more about, Jenna's having trouble commenting in the chat. If you want to talk more about social media, send us an email. Let me put our email in the chat again. Actually, let me. Oh, thank you, Cassie. I'm just going to type that. Yeah. Past tense, present tense. What do you, oh, we generally try and write in active voice as much as possible. Passive voice, there is a time and place for it, usually when you're more focused on the what happened rather than like who did it. But in general, and it's a best practice in plain language, using active voice is better than using passive. So writing actively as opposed to passively or in the past. Obviously, when you're talking about something in the past, you have to use past tense, but as much as you can, using active voice. And if we work together, that's something that we can work on together because I know writing in plain language and using active versus passive isn't always it can be hard. It can be very challenging. I've worked in communications for a very long time, and even I sometimes I'm like, how do I make this active? But again, I think there's a time and place for passive. But in general, we try and write an active, especially when we're talking about the work that we're doing. We want to give ourselves that active role and make sure that it reads engaging. Thoughts on mother tongue dominated content? I mean, it depends on the platform, obviously. For us, we write in English, but if you're writing for something for an audience in your country, and you want them to read it, it should be in that language for sure. But again, depends on audience and the platform where you're going to publish. You are welcome, Christabel. Thank you for being here. My cat just came in the room and he's meowing at me, so apologies if you can hear him. Jackie, what do you recommend for timing? I think if there's no more questions, we can probably wrap up. Again, these slides will be shared and you have our email address. I really hope that you use it and at least just say hi. But again, we're so thrilled that you are here and I hope you found this useful. If you have other questions or other tips that you want to talk about or question, anything, shoot us an email. We would love to hear from you. Thank you so much.
And again, I want to say thank you, Ellen and Jackie, and all of your colleagues that are on the call. I appreciate it. And we'll be sharing the webinar in the presentation on our webpage. So hope everyone will take time to rewatch. Thank you.
Thank you so much. Thanks for the opportunity, guys. Wonderful. Yes, I hope you do reach out. That would be great. All right. Bye, everyone.